Hi YouTubers, this is day 6.5 and I'm going with that because if you count the day of surgery as day 0, as my friend Barbara I think correctly probably makes sense, calls it, and then this would be actually day 6, with tomorrow being my 1-week anniversary for my surgery. But since I called yesterday day 6, I'm calling this day 6.5, so there you go. So I'm back outside with the hummingbirds and hopefully without the garbage trucks. And I had another place in my garden where I was going to sit, but the next door neighbor's kids' voices were coming pretty loudly through the fence. So I came back over here next to the ginormous rosemary bush behind me. You can maybe get a notice that it's about 5 feet tall and about 6 feet wide, and then Cape Cod honeysuckle above that, for those who care. So today I thought I would talk about why I did the vertical sleeve gastrectomy, and I do this in a way to maybe quell the critics that I think might be out there still among people that I know and maybe don't know, who maybe think I took the easy way out for weight loss, and maybe this is all voices in my own head of thinking that there are any doubters out there. And, you know, okay, maybe it is just me. Maybe I was the only one with any doubt. And the reason why I had doubt is that I just always felt like I should be able to do this by way of the usual weight loss programs. And believe me, I have tried, but I didn't also want to be one of those people who just said, yeah, I tried, and then know that the inner critics in my head would say, yeah, but, you know, not hard enough, not long enough, not consistently enough, or yeah, you tried, you were successful, but then you backslid or whatever. You know, what's the point of all of that? Why even go into all of that? Well, it's something that I'm going to have to work on in my own head, and one of the reasons why I'm going to be seeking additional help from therapy or whatever, you know, place I can get it, to get myself happy with myself completely. It's so that I don't use food as a crutch or my emotional go-to place. That's going to be key to getting or keeping the weight off once I'm there, getting the weight off on the way there, and never, you know, getting back to the really horrible health issues that I was having. So what are those health issues? Well, okay, so just being obese is a risk in itself. I heard that many times, but I would always challenge it with, but you know what? I have normal cholesterol. It's never been over 200. Is it 200? I'll have to look it up now, or is it 100? I don't know. Whatever normal cholesterol is, mine was on it was below the levels that are considered to be high, whatever that means. I'll have to get the exact numbers, I guess. I didn't ever have high blood sugar. I never had high triglycerides. I never had high blood pressure. Blood pressure is something I do know my stats on pretty well. I average 120 over 60. It can go as low as 90 over 45, at which point I start fainting a little bit. And the highest it has been, ironically, maybe not, has been when I've been anxiously awaiting discussions with my doctors over the last year or so. And then it would be, or the time I was in the hospital, I think in the ER and really stressed. And then it would run 158 over 80, in that range. But honestly, 120 over 60, 120 over 70 is my normal. So, you know, I'd point out all these statistics, and I would point out that every time I would go in for a physical, they would say I basically have the numbers of an athlete and of someone much younger than my 58 years. And you know, so I'd say, so what's the big deal if I'm happy with who I am, what I am, and you know, my husband loves me for who I am, and you know, why why worry? Now, about my husband, I'm going to say yes, he loves me for who I am, but I will also say he has been very concerned about my health for the last couple of years, and he just, you know, he would mention it all in health terms. He never would say you would look better. Never once did he ever say you would look better if you weighed less. But he said, you know, at your weight, you've got to have some health issues. And yeah, he was right. Well, the most obvious one, which he never pointed out, but would have been very easy for him to point out, and ended up being the reason why I didn't even have to have as high a BMI index as I did in order to get the insurance to approve my my surgery, is I had one very big risk factor, and it's a big one, and that's sleep apnea. So I've mentioned before that with me, the sleep apnea was getting to be very severe and getting worse. I already have my CPAP set at 13, for those of you who know what that would mean. It's a very high setting. I don't know if it's the highest, but it's a very high setting on the CPAP machine. I've had 3 sleep studies done in the last few years, and I've gone to, I think, 4 different specialists, and basically what they've all said, and the conclusions always were, is that I went to a dangerously low blood oxygen level while sleeping without a CPAP. And even with a CPAP, I was still waking up numerous times per hour and still having oxygen level at an unacceptably low level. So I know that if I try to lie down sleeping without my CPAP, I can't. I mean, fortunately for me, my body has a mechanism that wakes me up. Otherwise, I would be dead. If I didn't wake up when I stopped breathing during sleep apnea, yeah, I would die. So it's pretty simple. And you know, for my husband, he can be a pretty sound sleeper. But he would be awakened by my snoring, and then, but what concerned him the most was the fact that I would stop breathing altogether, and he would count 20, 30 seconds or more before I would gasp, and then sound like I'm just gasping for breath for everything that I've got. So, you know, that was scary to him, and, you know, once I started having doctors tell me that this threatens your life, I had to really think about it. And I thought back about when I first started getting sleep apnea, and I realized it was once I started reaching about 150 pounds. Now, all the experts that I consulted, I looked for other reasons why I might have sleep apnea other than fat, and came up with none. What they all said was I don't have any other obstruction, no other reasons for my sleep apnea other than the fat deposits in the wrong places, too much fat in the wrong places that are obstructing my airways, and that once I lose the weight, that'll go away and I'll no longer have sleep apnea. I've been told that consistently, and believe me, I kept trying to consult people who people who might give me another answer. I guess I was justifying a lot of things. Well, why? Well, one of them is vanity. I mean, imagine going to bed and 7 years ago when I first got a CPAP, I was a newlywed. And imagine going to bed with your newly married husband with something that looked like this, right? Not sure I can get this on. But for those of you who have had a CPAP or know someone with a CPAP, you know what these things look like. Now this is one of the better looking ones, but you know, isn't this nice? Am I going under the sea? Am I an alien? What the heck is going on here? So, not exactly sexy, right? But this thing keeps me alive. Ugh. So, messes up your hair too. Anyway, I'm very motivated not to have sleep apnea anymore. And when it got to the point a few months ago when I was having severe health issues, that the sleep apnea was also still getting worse and risking my health even more, and I seemed to be having more and more and more and more health issues. The one thing that was consistent, that was wrong, that was off on my body, was the sleep apnea. So then I thought, okay, I'm going to go to these different doctors and talk to them about bariatric surgery. I hadn't even given it a thought until a coworker had it done, and she was telling me how much it had helped her. And I didn't think of it as a possibility. It wasn't even on my radar at that time. But when I saw how she was just so energetic and look, of course it's the looks and the new clothes and all that kind of thing can be motivating, but those aren't the motivators for me. I'm not into the clothes thing, really. The most I've been into clothes and makeup and stuff actually has been in the last week that I've been doing these things for YouTube, and if my friends and family ever get around to commenting on these videos, they can back me up on that. This is the most makeup you've seen me in, right, guys? And I, whatever. I'm not into getting dressed up. But I digress again. Anyway, I went to doctors expecting them to talk me out of it and saying, oh, no, that's just an unnecessary risk. And why don't you just lose weight the old-fashioned way? You just need to exercise, you need to watch your diet, all that kind of thing. That's what I was expecting, and I was expecting them to say, oh, forget the surgery. To my surprise, they were all saying, yeah, I think that would be a good idea. We've been hearing good things about gastric sleeve. But of course I was cautioned that I have to have the right mindset going into it. I can't look at it as an easy fix or as a quick fix. There's going to have to be things that have to be worked on, and that I know and that I'm committed to. And so I gave it more and more and more thought, consulted more and more doctors, and as I had all these health issues over the last 6 months that I had more and more specialists. And so, trust me, I think I had 10 or 11 specialists that I could talk to, and my primary care physician, and I'm consulting all of them and asking the same question. All but one were very, very positive about me doing this procedure. The only one who was hesitant was my gastroenterologist, and it had to do a lot with the fact that I was consulting him about the surgery after I had been seeing him for 3 months with severe abdominal pain, which it turned out to be lactose intolerance and a bacteria infection. So far as we know, those are the reasons. We're still looking into it. And he was saying, you've been through so much already, and with this kind of surgery, they're going to be rearranging your insides, basically. And do you really want to go through that? You've already gone through so much. And so I didn't really answer him then, because I honestly didn't know at that point. That was that was back in April, I think it was. And I went through a few more health issues after that, including finding out that my sleep apnea had gotten even worse. So he's the one who was a naysayer, but everybody, and I think if I explained everything, I think he probably would have changed his mind. Whether he would have or wouldn't, I'll never know, maybe until I talk to him again. At any rate, got the thumbs up from everybody, and so you know what? I'm looking forward to getting rid of the sleep apnea, no longer having those risk factors for dying in my sleep. I especially look forward to not having that CPAP machine being the thing that stares at my husband at night. And the fact that I have to lug it around everywhere I go, every time I go on a trip, do anything, that thing is being lugged around. There's so much I'm looking forward to being freed of the sleep apnea, and you know what? That's basically my reason. Everything else is gravy.